Are we good?
Yeah.
All right. Good morning, good morning, good morning. We want to thank everybody for being here with us this morning at this very important location where, in many respects, the definition of the freedom struggle and the fight for all the things that really matter in people's lives is really best represented in front of the Catto statue. I'm State Senator Vincent Hughes, been in the struggle for expanding access to health care and making sure people have full and complete health care coverage for many, many years. And we're here on this day, at this moment, to recognize one of the most important legislative accomplishments in American history. 60 years ago, on this day, Medicare and Medicaid was signed into law by President Lyndon Johnson. That deserves a round of applause. Sitting at that desk with President Johnson when he signed the bill into law was former President Harry Truman, who was involved in the fight and involved in the struggle. And we're here at this moment to make sure that we never forget that moment. And this coalition of warriors, this coalition of fighters will make sure that we never forget that moment. But we will also make sure that the people understand we will not give up the fight for full coverage for every American citizen, no matter their circumstance, no matter their geography, no matter their income, no matter what health care challenge they have. They deserve health care, and we are going to fight for it each and every opportunity that we can. Now, we just witnessed on the 4th of July, a very un-American thing happened when the person occupying the White House and his MAGA cohort signed in the Big Ugly Bill. And in the Big Ugly Bill, we saw the layout of reduction in health care, or the removal of health care and health insurance for upwards of 17 million American citizens. And I dare say, that that is just the tip of the spear, if you will, for more folks to lose access to health care and for health insurance to become much more costly than it currently is right now. We will not give up the fight. Even though that was a setback on the 4th of July, we will not give up the fight. We will make sure that we remember every person who voted for it and every person who stood silent while it was happening. And that includes my Republican colleagues in Harrisburg, who said absolutely nothing when they saw that the health care services that their constituents were receiving snatched away from them. So I'm going to begin introducing our speakers. First up, a good friend for a long time, for mental health partnerships, Janine Lisitsky. Janine, come on up here.
Thank you, and good morning. My name is Dr. Janine Lisitsky, and I am the President and CEO of Mental Health Partnerships. It is with bittersweetness that I stand before you today, because we're here to celebrate 3 programs that have transformed our society, while also advocating against the impending cuts to Medicaid and other safety net programs. Nearly 30 years ago, as a young woman between jobs and cities, I was diagnosed with end-stage cancer. I had no health insurance and no savings, just a terrifying diagnosis and a fight for my life. When I needed a bone marrow transplant, I was told I would not receive it unless I was approved for Medicaid. That coverage saved my life, and that's why I'm here today. And I'm going to keep fighting for those who, like I once did, face a crisis without a safety net or a voice. That experience changed the course of my life. And it's why this celebration is personal. Medicare, Medicaid, and the Older Americans Act are not just policies, they are lifelines. They are the reason people survive, heal, and rebuild, and they are worth defending. Our organization was founded in 1951, before Medicare or Medicaid existed. But like President Johnson, when he championed these programs, our founders shared a resolve to ensure people could access the care they need. They came together to promote public interest in mental health solutions, laying the groundwork for the systems Medicaid would later scale. At the time, President Johnson said, quote, "For so long as man has lived on this earth, poverty has been his curse. Today, a great nation is able to eradicate poverty." That's what Medicare and Medicaid represent. Today, Medicaid covers over 73 million Americans. That's 1 in 5. And it's our largest tool in the fight against health disparities. And in fact, in Philadelphia, it covers 1 in 4 citizens. Medicare covers 1 in 5 Americans. That's over 68 million older adults. These are not small programs. Before these programs, getting sick often meant financial ruin or no care at all. Care was unequal, and health insurance was a privilege and not a right. Medicaid, Medicare, and the Older Americans Act changed that. They expanded access to mental health care and addiction treatment and allowed millions to age with dignity. They proved that when policy is grounded in compassion and equity, it can transform lives across generations. But as you heard today, that progress is at risk. H.R. 1, the so-called One Big Beautiful Bill Act, proposes deep, deep cuts to these very programs. These aren't just numbers on a spreadsheet. They're threats to the lives and dignity of the people we serve, of all of us. 60 years ago, our nation made a promise that illness wouldn't mean abandonment, that aging would not mean isolation, that mental health challenges would not mean being locked up. Medicare, Medicaid, and the Older Americans Act turned that promise into reality. So yes, today is a celebration, but it's also a call to action. Because if we don't fight to protect these programs, we will undo decades of progress. At Mental Health Partnerships, we know the work is far from over, and we will not stand by while these lifelines are threatened. We will fight for the resources our communities need. We will speak out for stronger protections, and we will work each and every day to ensure that the safety net not only endures but grows stronger for generations to come.
Thank you. Joining us now from the Pennsylvania Alliance for Retired Americans, Kathy Scott. Kathy?
Good morning. My name is Kathy Scott, and I am the parliamentarian of the Pennsylvania Alliance for Retired Americans, also known as PARA. PARA educates, organizes, and mobilizes seniors, workers, and unions to protect and advance retirement security for current and future generations. I am proud to stand with you today to celebrate 60 years of Medicare and Medicaid, two of the most successful and life-saving programs in American history. Since 1965, Medicare and Medicaid have guaranteed health care for hundreds of millions of older Americans, people with disabilities, and people with low incomes, and kept tens of millions out of poverty. More than 2.7 million people right here in Pennsylvania rely on Medicare, while more than 2.9 million people in our state rely on Medicaid. But today, instead of honoring that transformational legacy, Republican leaders in Washington, D.C. are undermining it. As you heard from Senator Hughes, on July 4th, President Trump signed the Republican budget into law, and it makes the largest cuts in history to Medicaid as well as Medicare benefits we earned over a lifetime of hard work. Even though Republicans in Congress voted to gut Medicaid and Medicare, we're not giving up. We're here to fight back and protect the care that we and our families depend on. Nearly 3 million Pennsylvanians rely on Medicaid. Here's who they are. 1.4 million children, 570,000 adults aged 18 to 64, 315,000 seniors, 421,000 people with disabilities of all ages. These are our kids, our parents, our neighbors, and ourselves. My family has relied on both Medicaid and Medicare for the health we need. My sister-in-law was diagnosed with multiple sclerosis in her late 20s. Once she lost her ability to walk, she entered Inglis House, a wheelchair community right here in Philadelphia. Her care was covered by Medicaid and then later Medicare and Medicaid. She received excellent care, and she was able to live the kind of life she wanted because she could count on Medicaid and Medicare. Medicaid was a lifesaver for our family and her elderly parents. I shudder to imagine how she and our family would have managed to take care of her and pay all her medical bills if she did not have Medicaid and later Medicare coverage. The Republican budget bill, which slashes nearly $1 trillion from Medicaid over the next decade, is a direct attack on health care for millions of Americans, people like my sister-in-law. But here's the thing, Medicaid is a lifeline, not a luxury for seniors. Since 1965, Medicaid has helped provide health care for the people who need it most, including millions of seniors. Medicaid keeps seniors in their homes and pays for the nursing home care. 5 out of 8 of Pennsylvania nursing home residents are covered by Medicaid. Medicaid doesn't just pay for nursing home coverage, it also pays for long-term services and supports that enable seniors to remain in their homes. Approximately 93,000 Pennsylvania seniors rely on Medicaid to pay for home and community-based care that they need. These care services keep seniors out of nursing homes, which are much more expensive. So Medicaid actually helps our health system to save money by enabling seniors to age in place. But the Republican budget law does not only put such vital home and community-based services at risk, it will also place 1 out of every 4 nursing homes in the United States at risk of closure. Where will those ill and disabled seniors go when the nursing home closes? Who will take care of them? The Pennsylvania Alliance for Retired Americans calls on the entire Pennsylvania congressional delegation to reverse these extremely harmful Medicaid cuts. We also call on our state legislators to take decisive actions to preserve Medicaid and find other revenue streams to fund Medicaid in Pennsylvania. The Republican budget law also triggers automatic cuts of, wait for it, $490 billion to Medicare over the next 10 years. That's just not numbers on a page. I am a retiree. I am a Medicare beneficiary. I also pay from my monthly Social Security check a deduction for my Medicare Part B. So to think that these are just programs that they can get rid of, we all, retirees, depend on it. Those cuts mean lower payments to doctors, hospitals, and home health agencies. It means some providers may stop taking Medicare patients altogether. It also means we could face higher co-pays for our care and prescriptions. These cuts threaten the very foundation of Medicare by pushing the trust fund closer to insolvency, moving the date up from 2033 to 2032. That's 1 year less of guaranteed benefits unless Congress acts. Instead of lowering our drug costs, this law protects drug company profits. It creates a loophole, a special orphan drug carve-out that blocks Medicare from negotiating lower prices for some of the most expensive medicines. That giveaway will cost taxpayers nearly $5 billion over the next decade. We fought so hard to be able to negotiate prices with prescription companies, and now they're throwing it all away. We can't allow cuts to the Medicare benefits we paid into our whole lives. The Pennsylvania Alliance for Retired Americans is calling on Congress to block these cuts by waiving the pay-go law and to restore full funding for Medicare. On this 60th anniversary, let's honor Medicaid and Medicare, not just with words, but with actions. Stand with us, speak out, and demand that our elected leaders protect and strengthen Medicaid and Medicare for today's retirees and tomorrow's. We may have lost the vote, but we haven't lost the fight. Join us as we demand hands off Medicaid, hands off Medicare, hands off our health care. Thank you.
How about that, Kathy Scott? Give her a round of applause. I'm so excited about this Medicare, Medicaid that I advanced the birthday. It's actually August 5th, not August 1st. It's actually August 5th. And so this conversation today is to get more folks more engaged, more involved, so that when August 5th does arrive, we have more action and more public conversation about this very important piece of legislation that was just destroyed with the big, ugly bill. And we will not forget who was involved, what they did, and those who were silent as they were complicit on the matter. Joining us now is Wendell Royster, Vice President of SEIU Healthcare VA. Is Wendell here? Wendell's here?
Good morning, everyone. My name is Wendell Royster, Vice President of SEIU Healthcare Pennsylvania, where we service 25,000 nursing home workers, hospital workers, and home healthcare aides across the state of Pennsylvania. So we keep Pennsylvania healthy. I just want to say happy anniversary to Medicaid and Medicare. Say it with me. Happy anniversary to Medicaid and Medicare. Happy anniversary to Medicaid and Medicare. With that being said, we are in negotiations with 97 nursing homes across the state of Pennsylvania as we speak. And we cannot negotiate without bringing up what the cuts of Medicaid and Medicare is going to look like. Some of the nursing homes that we represent have or receive 67% of Medicaid and Medicare. So with that being cut, it will really be devastating to some of these nursing homes. What we do know is this legislation, when it took place in 1965, I was birthed in 1966, so I can say I was a Medicare baby. And I just want to say to you guys that we spend a lot of time trying to educate our communities and our members about what this big, bad, ugly bill is going to look like come 2026. And what I find that's very devastating is that too many people is too lax about it. Too many people is just walking around like they don't know what's coming. And I don't mean no harm, but I hate to be playing defense all the time. Sometimes you have to get on offense. Do you agree?
Yeah.
So with that being said, again, I don't have a long speech. I'm not going to do that to you. But just to let you guys know that SEIU have sent 500 of our members to Washington, D.C. to bird dog these guys when the vote came up a couple weeks ago. After the vote came, we also were in different counties at some of these sites that these politicians hold down as their office. And we actually did a couple actions on the 26th of July. What I will say to you is now is the time to get off the balcony and on the dance floor, because again, we lost the vote, but we didn't lose the fight. We know that Medicaid and Medicare saves lives. We also watch Crozier just close. We cannot afford to let these small royal hospitals close due to these cuts. We have to be smart, we have to go on offense, and we must do something to stop this. God bless you guys. Again, happy anniversary to Medicaid and Medicare. Wendell Royster.
Good job. Let's acknowledge the presence of Representative Burgos here. Rep, thank you, brother. Thank you. Always count on him. From Mental Health Partnerships, I'll make sure I'm saying this correctly, Luis Quiles.
Thank you. Hello, everybody. First, I want to say happy birthday to Medicaid and Medicare.
Happy birthday.
My name is Luis Quiles. I'm 50 years old. I live with schizophrenia, PTSD, and diabetes. And I'm alive and stable today because I have access to Medicare and Medicaid. Let me be clear. These programs are not handouts. They are not extras. They're lifelines. Without my medications, I lose touch with reality. I fall into depression. I get physically sick, and yes, I've been there. I know what it's like to suffer without care. Years ago, I didn't have access to medication. I became unstable. I committed a crime during a mental health crisis. I was deemed incompetent to stand trial for 3 years, and I spent 3 years in Norristown State Hospital with proper medications there. In total, I lost 17 years of my life because I couldn't afford my medication. And I'm not alone. But today, I'm a certified peer specialist. I work on a mental health chat line, helping others through their darkest moments. And guess what? I'm also in college. Studying to earn my associate's degree in behavioral health. I'm proud of how far I've come but I would not have made it without Medicare and Medicaid. And I'm not alone. 88 million people in this country are on Medicaid or CHIP. 66 million Americans rely on Medicare. 1 in 3 adults with serious mental illness is covered by Medicaid, like many other people I know in my life. If this legislation that was recently passed means we are cutting lives, we're cutting stability, we're cutting care. And here's the truth, cutting Medicaid doesn't save money, it just shifts the cost to jails, ERs, and broken families. So why cut something that works and has been around for 60 years? Today, I'm living proof of what happens when care is funded. I'm working, I'm studying, I'm helping others, I'm building a life. But if we lose these programs, we'll see more hospitalizations, more homelessness, more incarceration, and more unnecessary suffering. Let's keep Medicaid and Medicare around for another 60 more years. Thank you.
All right. Good job. Good job. Good job. That's a great story. Give him a round of applause. It's a great story. Joining us now from the Alliance of Community Service Providers, Michael Donovan. Michael, come on.
All right, thank you, Senator Hughes, very much. You know, at a Senator Hughes event, it's not uncommon to hear the phrase, put the people first.
Put the people first.
On brand. And this is in the spirit that we come together today. On behalf of our President and CEO, Sherry Brummins, it is an honor to join you celebrating the 60th birthday. As part of President Johnson's Great Society, the United States launched Medicare and Medicaid not just as health insurance programs, but as a promise that Janine spoke about. But that promise didn't keep itself. It was and still is carried out by a workforce which does much of its work in the shadows and without fanfare. From frontline nurses and caseworkers to direct support professionals, behavioral health counselors, peer support specialists, billing staff behind the scenes, the Medicare and Medicaid workforce has done more than deliver care. They have quietly delivered justice. They have quietly delivered hope. They have shown up day after day, decade after decade, to care for our neighbors with intellectual and developmental disabilities, to walk beside those battling addiction, and to comfort families navigating some of life's hardest moments. They have built the scaffolding of long-term care, behavioral health, and community-based supports in every corner of this country. And they have done all of this often under strain, underpaid, overworked, and too often overlooked. Yet they never stopped. Thanks to their tireless efforts, millions of Americans are alive today who might not have been. Children born into poverty who might have grown up healthier. People with complex medical needs have lived fuller, more independent lives. Communities have become more resilient not only because of the services provided, but because of the people who provide them. So today, as we mark 60 years of Medicare and Medicaid, let us not celebrate the policies or the programs. Let us celebrate the people. Put the people first.
Yeah.
Let me hear you. As we've often heard the senator say. And I'm talking about the peer support specialists, the direct support professionals, the case managers, the home health aides, the behavioral health teams, the therapists, the advocates, the administrators who have held this promise together, not for recognition, but because it was the right thing to do. And I'll leave it at that.
Very important. People do not talk about the fact that when these cuts go fully in place, thousands, if not millions of people will lose their jobs. Healthcare providers, folks who turn tragedy into triumph by helping people out and providing real healthcare services, they will lose their jobs. Don't ever forget that. Don't ever forget the loss that will occur. Don't ever forget that. Joining us now from the Mental Health Partnerships, Dan Miller. Come on, Dan.
Thank you everyone for having me. My name is Dan Miller. I'm the business manager for the training department at Mental Health Partnerships. First, I'd like to say happy birthday to Medicare and Medicaid. 60 years. Also, I am board certified as a certified peer specialist. I'm here to tell you my story about how Medicaid saved my life and put me on a path to self-sufficiency. While I faced mental health challenges my whole life, things took for the worse in 2014. I lost my job, I lost my car, my home. I felt like I lost everything, and I was laid off due to budget cuts. When my unemployment ran out, I had no income or insurance. So I went back to school at Rowan University and only lived on grants while losing my car because I could not keep up with the payments. Not too long after, I lost my cat, and he was only 6 years old. But because I was in school, I qualified for Medicaid, and that made all the difference in the world for me. Medicaid paid for my medication and my doctor's visits. Without it, my situation would have been so much worse. However, just when you think things couldn't get much worse, it did. In 2017, I survived a very horrific trauma, and it nearly broke me. I was sexually assaulted, and as a gay man, that was incredibly hard to process. I had to drop most of my classes, but I kept one class, Introduction to Philosophy, because it was the only thing I had, and it gave me something to hold on to. Because of that, I started intensive outpatient therapy, 3 days a week for months, in addition to individualized therapy, and I also had to apply for Social Security disability. I remember holding my breath during the summer of 2017, trying to follow the ups and downs of the Affordable Care Act drama. It was near my birthday, just like today, near my birthday. I will always remember when Senators John McCain, Lisa Murkowski, and Susan Collins deciding votes saved Medicaid and saved my life. However, on July 4th, the exact reverse happened. And it just pains me today to think about how many people are in the same situation I was, who were holding their breaths beforehand, who now have so much in anxiety and so much to worry about because now they're afraid of losing their health coverage. Fortunately with me, with ongoing therapy and hard work on my recovery, I joined Mental Health Partnerships full-time in 2021. Not to brag, I have also been promoted 3 times. And I currently, while I also got this promotion, I worked full-time and went to school full-time and received my master's degree in public administration at the University of Delaware in July 2023. How many people now who could possibly have that way of being a productive member of society will not have that chance again? I think about this constantly. Granted, not everybody may be able to fully recover and go back to work. But now, because healthcare is being stripped away, now we're guaranteeing that many people may not go back to work. My story is one of many. It's not just about me. It's about people with mental health challenges in shelters, receiving addiction services, and those who rely on this program to heal and rebuild just like I did. Medicaid is not just a safety net. For many, it's a lifeline. Without it, recovery and hope would be impossible. And I stand with people today I will not stop fighting for those people who need that today, because that's what I work in. And I want people to have the same opportunities as I did. Let's remind those legislators and the president in D.C. that they work for us. And the majority wants these programs to work for us. Power to the people.
Good job. Happy birthday, Medicare and Medicaid. Happy birthday, Medicare and Medicaid. Happy birthday, Medicare and Medicaid. To close us out, I don't know of a fighter like this one. I haven't met too many fighters like this one right here. She's fights in this building, always on the righteous side. Please welcome our council member, Rue Landau.
Good morning, everybody. Let's do this again. Happy birthday, Medicare and Medicaid. Happy birthday, Medicare and Medicaid. Today has been a day where we have heard the stories of people whose lives have been saved by healthcare. These are the stories that we have to tell. While we are in the midst of watching the dismantling of our safety nets, of our lifelines, it is essential that we now stand up more than ever, and we are the ones who will fight to save our health care. And we need everybody to join this fight. You know, this legislation has been around since 1965. It was codified the value that health care is a human right. Healthcare in America is a human right. The bill saved millions of lives, especially those of seniors, low-income residents, the disabled population. And here in Philadelphia, cuts to Medicaid and Medicare will particularly harm our Black and brown populations, our disabled population, our LGBTQ population, and our young people all the way across our city. The harm will be felt by families in Philadelphia. For over 60 years, our lowest income residents have felt the emotional and physical benefits of accessible and affordable health care. And now in 2025, when we should be advancing and building what we have worked on, ensuring in America that we are taking care of all of our people, we are at the moment of watching the biggest cuts ever to this program, and the cuts that will harm more Americans than we have seen ever before. New employment standards will be enacted. Our rural communities throughout Pennsylvania and the country will see less care availability. Doctor visits will cost more. The list goes on and on. And this isn't what Philadelphia is about. We're about brotherly love, sisterly affection, and sibling solidarity. So we need to show some solidarity right now. And from what I heard today, I've got to tell you, the federal government says they want to make Medicaid and Medicare work better with these cuts, but we know that it will do the exact opposite. Not just here at home, but across the country. What we heard today with the personal narratives and the personal stories is exactly what we need to do nonstop. We've got to tell the stories, we've got to personalize the cuts, and we have to be the future visionaries that can show people now what the future would look like. So everybody get ready for your time travel. These are the stories we need to tell. This is the way we got to do it. We've got to show Philadelphia, Pennsylvania, and America what the future will look like if these cuts are enacted. And we know the harm that they will create. We've got to tell the stories. We've got to stop this now. We might have lost the vote. We didn't lose the fight. Every single one of us have to get out there swinging, fighting even more. We can reverse this. We can make sure that we protect health care for Philadelphia, Pennsylvania, and everyone around the country. So thank you, Senator Hughes, for bringing us together. You are an incredible leader in this issue. Shame on anybody who voted, all of our legislators who voted for this a horrific, painful, disastrous bill, and shame on anybody who didn't speak out against it. We have Republicans in Harrisburg who could be leaders right now to save health care for Pennsylvanians, and we need to keep pressure on them to make sure they come out and they speak out, because it is incumbent on all of us to save health care for all of our neighbors, our loved ones. Thank you, everybody. Happy birthday! Thank you, everybody, for coming today. Appreciate you so much. And again, thank you so much to Senator Hughes for organizing this incredible press conference.